Louisiana, Florida, and Texas were among the first states to see a surge in the Delta variant of the coronavirus. Now it's hitting other places hard, like those states in the Northwest. The question doctors now have is, how will Hurricane Ida impact COVID cases here? As Meg Ferris reports, it may be too soon to tell.
Hurricane Ida sent many of us packing. With so many concerns, you may have let your guard down with mask wearing and distancing. Entire families stayed with friends out of town, neighbors with generators, or huddled in shelters. And now we're surrounded by the many here helping us clean up. An ideal storm for the spread of the highly contagious Delta variant. But so far, Dr. Jeffrey Elder at LCMC Health says cases are going down.
Our inpatient numbers actually have been looking really good across the state. So for us locally, we really hit our peak of COVID inpatients in the hospital around the 20th of August.
If you go back to a month ago, we had 1,009 COVID patients, and today we're at 386. So certainly that has headed in the right direction.
But we're not out of the woods yet.
We would hope that within the next 2 weeks after everybody comes back, we would see whatever the impact would be. But so far, so good.
Is it possible that we already peaked before the rest of the country and we were on this downward slope and will continue?
Yeah, that's the hope.
And while we were dealing with power outages and blue tarps, preliminary study results from U.S. researchers showed masks can slow coronavirus spread. Done in the real-life world in Bangladesh, it suggests just a 30% increase in mask wearing leads to a 10% drop in infections.
That's a number of people who would have avoided getting infected, would have avoided getting sick and coming to the hospital, would have avoided death.
And if you're not infected, you can't spread it to even more people. Masks are especially important indoors.
And there's no doubt that that the more ventilation that we have, outdoors, indoors with really good ventilation, I mean, those sorts of things are absolutely going to be a much better situation than if you're in a closed quarters.
So our case numbers can continue downward. Meg Ferris, Eyewitness News.